When we talk to people across the Champlain region, we often hear about some of the challenges that people have getting to and from healthcare services. And one of the ways to access those services is to have transportation to get to where they need to go.
Back in 2007, the ministry moved community support services under the LIN umbrella. Transportation services was one of those services. So non-urgent transportation services for individuals who are certainly medically stable and can be comfortably and safely transported through a non-urgent transportation system. The service is very much designed to serve seniors as well as people with physical limitations.
I go every time on the grocery bus, and they also drive me to my doctor's appointments.
It's a very friendly, good service. Well, it helps you to be more independent, and that means a lot to me anyway.
The agency vehicles have a turning seat that lowers to the ground for someone that has mobility problems. So they don't have to climb in, they can actually just sit in and the seat will bring them up safely. They have all sorts of grab bars that the cars obviously wouldn't have. They have easy steps, so they've been added sort of extra siding so someone can step in easier.
So non-urgent transportation services is available throughout the entire region. We have 26 community service providers across the region that provide this service, right from Deep River through Ottawa to Hawkesbury.
The Good Companion Senior Centre has been around for 58 years, so soon to be 60 years. At the centre we offer programs and services for physical activity and social interaction. And then we have the community support services, and community support services provide services to seniors and people with physical disabilities to help them to remain at home as long as possible.
Non-urgent transportation service here at the Good Companions, it's part of the community support service that we offer. And what we do is that we help clients that need to get to their priority appointments. So those types of appointments would be any type of medical appointment. So that could be doctor, dentist, physio, anything that's related to your health.
Some of the clients that we take to medical appointments are very frail. They have maybe conditions such as cancer or kidney disease, and they're going for treatment that is really essential for them to maintain their health. Sometimes they've had a hospital stay or they've had surgery and they're coming to the hospital for a follow-up appointment. So it's really important to them that they get back to the hospital to see the doctor post-surgery.
The adult day programs are available throughout Renfrew County and throughout Champlain LIN. The main focus for those programs is to provide respite care for the caregiver and also provide meaningful and stimulating activities to our clients and help them stay healthy, get proper nutrition, and allow them to stay living at home as long as they safely can do so. The transportation is an essential part of that, especially here in Renfrew County, where we're very rural and a lot of people have no other source of transportation available to them.
We also drive people to grocery shopping. It's essential that they can get out and do their grocery shopping. So sometimes using other means of transportation for grocery shopping can be challenging. So it's really great to be able to get our clients and give them access to healthy options for their meals. And they can plan to go out shopping on a regular basis. It also gives them the opportunity to socialise and connect with other people who shop at the same time as them. And they look forward to shopping with their friends in the store and just being able to share a cup of coffee while they're waiting to go back in with the driver.
The vast majority of clients that we pick up, one of the very first things they expressed when they get into the truck was how amazed they were that the service existed, and they wonder how long we've been doing this. It gives them the opportunity to get out to medical appointments, the dialysis, whatever the need may be.
I remember the first time I met Jean. She's a very fiercely independent woman. She's tried to do as much as she can on her own for as long as she can, but over the past few years she's had a series of blows to her health that's decreased her mobility. Suddenly taking the bus on her own is simply not an option, and she had been relying on taxis. Now with the non-urgent transportation program, she has someone that walks right into the apartment, and the apartment door, greets her, walks her into the car, gets her safely seated, has a friendly conversation with her on the way to the doctor's appointment, which reduces her anxiety. She said to me, before going to the doctor's was a very stressful thing. Now I get to see one of my friends, one of the drivers, who talks to me and calms her down. When they get there, they help make sure she finds where she needs to go. And if she's going to a new hospital or a new doctor's, they make sure she gets there safely.
Oh, I think it's a great help. It's a great support to me. I depend upon it. It's nice to have it. I didn't know they had this before I was ill. And they suggested it to me, and it was something I jumped at right away, you know. It was quite good, so it was nice to have it, yes, definitely.
In many cases, there are clients of the transportation system that need to make the same trip several times over the course of a month. And so the non-urgent transportation system provides an affordable option.
It's also avoiding the inconvenience of using other transportation services. Our drivers pick the clients up from their homes, drive them safely to their appointments, and they know that they're going to be brought home safely to their front doors. The drivers make a wonderful connection with our clients. They do get to know them very well, which is really appreciated by the clients because sometimes they're having to face difficult situations in their appointments, and so that extra reassurance goes a long way.
Before the LINS, there were multiple organizations providing transportation, but they really had no way of coordinating their efforts. So we sometimes would see vehicles that would be on the road that weren't full when they could have been if there had been a way for people to share drivers or share schedules. So the LIN really played a role of a catalyst to bring those different providers who were offering transportation services to a same table.
I think the partnership between the Champlain LIN and our organisation has played a major part in us being able to provide more non-urgent transportation and has benefited our agency in a great way.
Without the agency vehicles provided by the LINs, we simply could not even meet half of what we're meeting now. Now people get far more drives more often. They can also call with shorter notice because we have the ability to check everyone else's schedule.
So the non-urgent transportation program has had a tremendous impact at multiple levels. First, for the people who use the system. We're also seeing it at the system level because this is a much more coordinated and integrated way of offering a service. So we're making better use of the resources that we have. So sometimes for the same amount of investment, we're able to stretch those dollars further. We're able to get more out of the services that are there.
I think that transportation is just going to increase as the older adult population grows, because we know that's happening in Canada, and I think that the service is going to expand, so this program is definitely needed.
We're continually making improvements to the non-urgent transportation system, and we're really learning from patient and from client experience. We understand where the communities are that have the highest need, and we'll make sure that when we provide growth, we're providing growth in those